Dr. Jackson here with a wonderful patient who has been kind enough to sort of incorporate us into sort of the decision-making process that we do here. So I guess my question to you is, what are the main things that bother you?
I'm having a low vision issue, so I need the eyelids out of the way.
Okay.
And then I've chosen to get rid of these bags. And that's what I'm here for.
Yeah, that's good. So what we had talked about and sort of the decision processes and thoughts are, she has a little bit of low brows on both sides. We did talk a little bit of forehead lift, but didn't necessarily want to go that aggressive. There's a little low brows, sort of diffuse across the bony part here. And her left upper eyelid's a little bit lower than her right upper eyelid. So what we talked about doing is we're going to take some skin off the upper eyelids, a blepharoplasty. Then tunnel up to the brows on both sides and do what we call an indirect browplasty. That should give her a little bit of a lift on this outside here. Nothing real dramatic, but it helps hold this outside corner up. And then from there, once the brows are set, we'll come to the left upper eyelid, put a stitch in to raise this eyelid a little higher. And that basically will bring, I won't hurt you, it'll bring it up a little bit higher.
So you're just trying to match
the right side. So we're just doing the left side. And then we'll move down to the lower eyelids, and she has a little bit of thinning in the mid-face, which is not uncommon. She says she's always had this deep, what we call tear trough, these deep grooves ever since she was a kid. So what we're going to do is come from the inside, take the fat that's there, release this off of the bone, this retaining ligament. Then we take the fat and we move it down in the cheek. So it'll achieve two things. It will decrease the fullness in the lower lids here. It will soften this groove itself, and then it'll both fill up the mid-face a little bit and give us more smooth transition from the upper eyelids, or sorry, from the lower lids to the cheek.
So it's a fat transposition.
Fat transposition.
Okay. Great.
And then there'll be a little bit of skin pinch to take out the extra skin that's going to be in the lower lids.
Oh, this is going to be fun watching the
So,
actors. Awesome.
Pretty common thing that we do here. This is not atypical for a lot of the patients. We give them a lot of different options, talk about the pros and cons, and then let them choose what they want to do.